All right. Well, good morning, everyone, and thank you for attending today's Medicare Transition webinar. Okay. Also, as one of the attendees that I have with me today, I have Yolanda Smith, who's from Kaiser. So if anyone has certain questions that I can't answer, she'll be able to step in and assist with any information that's needed to help clarify things. Thank you, Yolanda, for joining. Okay, so today's introduction agenda, of course, today we did have the introductions. It was Mike, we met Mike Farah, Ish Pina, okay? And again, my guest today would be Yolanda Smith from Kaiser. Today we're going to talk about give you a Medicare overview, and we're going to talk about the ACERA and the Medicare mandate that ACERA has, and then we'll talk about Medicare and how it works, and of course we'll go over some of the Medicare plan options that you have, and then we'll, of course, we'll be available for questions, okay? So, who's eligible for Medicare and who's involved? Well,
And Ish, we do have a hand up to start off with. I don't know if that was an accident but if you're the one with the hand up, you can go ahead and unmute yourself and speak.
Someone had a question already?
Mm-hmm.
No, maybe it was an accident.
Okay.
Okay. All right. So who is involved? Okay. Well, people 65 and older. Okay. Under 65, if you have a disability, if you're disabled, and it's deemed by Social Security, they have their own criteria as far as disability. And so then that's when they may grant you your Medicare earlier than 65. Nope. Someone's talking. Okay, so people any age with ESRD or ALS, Lou Gehrig's disease, okay, and basically it's Social Security Administration, and then the Center of Medicare and Medicaid Services is where they would send you your Medicare card. Okay.
Is there a question?
Someone's talking in a foreign language. Do you have a question? If not, can you mute yourself?
No, not yet.
Mike, can you mute them?
Okay, I'm going to go ahead and mute them and disable talking. So, okay, we're good.
Okay, you can go ahead and advance the screen. Okay, so currently receiving Social Security. So if you are currently receiving Social Security benefits, enrollment in Medicare Parts A and B, basically it's automatic. We still encourage members to go ahead and contact Social Security just to let them know, hey, I'm going to be turning 65. And I just wanted to check in to make sure you have all my information current for me to receive my Medicare A and B. Okay, it's always good to just check in. Medicare Part B premium will be deducted from either your Social Security check or they'll bill you directly. They'll send you a bill and they'll bill you quarterly. So they'll bill you for 3 months worth for your Part B premium. Okay, but at ACERA, we have a program, and I'll talk about this a little bit later in the program. MBRP reimbursement, Medicare Part B reimbursement, and we put an adjustment credit into your monthly retirement benefit every month. So you're paying 3 months to Medicare, Social Security for your Part B, but in your monthly retirement check, we're also giving you an amount that will offset that to a certain amount. Okay. Now, some retirees or dependents are disabled, who are disabled may be eligible for Medicare earlier than 65. Again, that goes back to the disability. Okay. Next screen. So if you're not receiving Social Security, if you're not currently receiving Social Security benefits, you check, most retirees are eligible to enroll in a Medicare A and B at 65, even if you're not collecting Social Security at that time. For those eligible at 65, we encourage you to begin the process for enrolling in Medicare at least 90 days prior to your 65th birthday. Okay, so for example, if your birthday is in October, then now 3 months before October, which is July, we would say you may want to reach out to Social Security and start the process for getting your Medicare. Okay, now if your birthday falls on the first of the month, then everything moves up a month. Okay, so again, if your birthday falls on the first of the month, for example, typically your Medicare will become eligible the first of the month in which you become 65. So if your birthday is in October, for example, okay, then Medicare will become effective October 1st. However, if your birthday falls on October 1st, then your Medicare would begin September 1st. They move it up a month. Okay, so we advise you give Social Security a call to obtain information about how they would expect you to go ahead and enroll. Some people would go ahead and do it online by going to their website. Okay, and you want to go ahead and enroll in Medicare Parts A and B. Okay. Next screen.
And Ish, we have a question up on the board, and it's
Sure.
kind of detailed, so let me break it down. So it says, is my understanding of the process for me accurate? Okay, so they say, I turned 65 in March of 2022. I have United Healthcare Signature Value HMO, and that means a February 1st insurance year. So I want traditional Medicare with Medigap. My understanding is I just continue the insurance as is through open enrollment to keep the HMO until the end of February. Then I sign up for Medicare after December 1st. Then I choose a plan through Via Benefits, and then I inform Acera of the March 1st change. Am I understanding this accurately?
That is correct. Yes. And you'd want to let us know as early in February, if not in January. As soon as they get you enrolled, they say, hey, okay, yeah, we got you enrolled for the March 1st, because you want to give us time to be able to shut off the deduction for that United Healthcare plan that you have with Acera, so that we don't do the deduction out of your February 26th, your February payment that pays for March, because you're not going to need the March because you're going to be over with the other plan. So we want to stop that deduction coming out of your February payment from Acera. Okay, so I want to make sure you give us early advance notice about that, so that we can go ahead and stop that deduction. Okay, if it does occur, we would still go ahead and do an adjustment and refund you back that deduction, but it ought to be good for us to stop it ahead of time. That way you don't have to wait for your refund about that. Okay, Acera's Medicare Mandate. So when you or your dependent become eligible for Medicare, which is usually at 65, in order to continue enrollment and receive the Medicare and basically the MBRP not the MBRP, but the monthly medical allowance that we pay for your coverages, you need to transition over to a Medicare plan. Okay. For example, like there was the question that this other member just asked, they're on the United Healthcare plan. Okay, we only have a non-Medicare plan, the HMOs with United Healthcare in Acera. So when you become Medicare eligible, you need to transition over, either going to the Kaiser Senior Advantage Medicare plan, or you're going to go through Via Benefits to get a Medicare plan through them. But you cannot remain on the United Healthcare HMO. Same thing with the Kaiser plan. If you're on the Kaiser HMO plan with Acera now, when you become Medicare eligible, you need to move over to the Kaiser Senior Advantage plan. You cannot remain on the HMO plan with Kaiser. Okay, and currently the carrier offers with the Medicare group plan, we only offer Kaiser Senior Advantage. Everything else would need to go over to Via Benefits. Okay, and they do have plans that are nationwide. Acera's Medicare Mandate. And here's an example of another reason why you do want to go ahead and change over. So for example, using this sample, Mike, can you raise it up a little bit? It's a little, I thought there was more. Oh, that is the bottom. Oh, that is the bottom of the chart. Okay. So for example, in this example, we have someone who has 17 years of service and they're turning 65 and Medicare eligible. They're on that Kaiser HMO plan. Okay. Currently, that premium is $810.72. Okay, with 17 years of service, the MMA monthly medical allowance that Acera pays towards that plan for them is $433.99. That leaves an out-of-pocket difference of $376.73 to come out of their monthly retirement check. Okay, now the same person becomes Medicare eligible. They join this Kaiser Senior Advantage plan. Okay, and that plan is currently $382.21. Acera is going to subsidize the $382.21 and that leaves a zero out of pocket to come out of their monthly benefit. Okay, that's $376.73 that they get to keep in their monthly check, in their net. Okay, so you can see how they save money. In addition to that, their copays on the Senior Advantage plan drops down to $10. Okay, on the HMO, your copays are $15. On the Senior Advantage, it drops down to $10. So that's an additional savings depending upon how many medications or office visits you have. Okay, so you can see where you can save quite a bit of money when you start going over to into the Medicare plans. Okay. What is Medicare Part A? When you become eligible for and enroll in Medicare, coverage is provided as follows. Medicare A provides hospital insurance. Okay, so the Part A, basically they cover hospital stays, skilled nursing facilities, rehab, not long-term care, but they do take care of hospice care, home health care, some blood and hospital care from qualified medical providers. You typically do not pay a premium for Part A Medicare. Okay, if you met all the quarters accordingly by working and paying in, then majority of us, we get Part A free. There's only some members who do have to pay a Part A if you are a safety member and you've always been a safety member and you've never paid in. When you go to apply for your Medicare, they may say that you don't qualify for the free Part A, and so they may try to charge you for that. But we do have, if you're going to go on the Kaiser, we do have a Medicare Part B only plan that we can get you into. So you just can go ahead and just waive getting the Part A and just to get your Part B, and we can still get you into a Kaiser Senior Advantage plan, Part B only. That way you can go ahead and still save some money, like I showed you earlier. Okay. All right, next screen. Okay. Enrolling in Medicare Part A. For the majority, Medicare Part A costs nothing because you or your spouse or your ex-spouse, married for 10 years, paid Medicare taxes while you were working and earned quarters towards the Medicare Part A. Okay, so again, if you paid in 40 plus, it's free, no premium. Okay, of course, if you didn't meet all the quarters, then they may charge you a certain portion. Okay, if you yourself don't qualify, you can always inquire with Social Security regarding if you can qualify based on your spouse's eligibility. Okay, so that's another way to check in with them to see if you qualify, if they say that you do not. Okay, for 2021, you may pay up to $471 monthly to buy Part A. Okay, if you don't get it free, so you make sure you want to contact SSA. If they say you will need to pay for Part A, then you want to make sure that you can go ahead and get the Part B, and we can always just get you into a Medicare Part B plan only if you're going to Kaiser Senior Advantage. If you are not going to go to Kaiser Senior Advantage, and you're going to go to via benefits to find a Medicare plan out there, you got to keep in mind the individual carriers, they do require both A and B. Okay, so only our Kaiser Senior Advantage plan do we have a Part B only plan. Okay. All right. If you do not enroll in your Medicare when you turn 65, okay, you may incur a late enrollment penalty. So you want to make sure that you enroll into your Medicare and that you do enroll into a Medicare plan. Okay. Basically, it's a 7-month window. The month in which you turn 65, 3 months before, and 3 months after. Okay, so you got some time to make a decision. But remember, as long as you're remaining on our non-Medicare plan, you have a cost that we're taking out of your monthly benefit. Okay, so you do have a portion that's coming away from you. So the sooner you decide to get into a Medicare plan and you're able to enroll in one, the sooner we can stop that other deduction and change it so that you're not having that out-of-pocket cost. So you do want to save some money by enrolling right when you can. Okay. All right. Next screen. What is Medicare Part B? Well, Medicare Part B provides medical insurance. It pays for Medicare approved doctor services, outpatient care, certain preventive care services, diagnostic tests, things like that. Things that Part A doesn't cover. Okay. So, and you will have a Medicare Part B premium. Okay. It does cost to have Part B. for most Medicare eligible individuals, the monthly premium in 2021 is $148.50 a month, okay, which is the lowest standard monthly Part B premium amount. And I have a chart coming up to show you how that's determined, okay? So some members will pay more depending upon their income, and the premium is usually deducted from one Social Security check. Otherwise, you're billed quarterly. So you got to keep in mind, they do a 2-year look back, okay, when they're trying to figure out what they're going to charge you for your Medicare Part B premium. Right now, we're in 2021. They're going to do a 2-year look back, and that 2-year look back would be they're going to look at your 2019 tax return to see what you're reporting, okay, and that's where they would determine what your premium is going to be, okay. All right. So you can go ahead next screen.
And we do have a question.
Okay.
Question is, I have United Healthcare HMO covering myself and my wife, and I'm turning 65 this December. If I want to switch to Kaiser Senior Advantage, should I wait for open enrolling in November to switch over?
Well, open enrollment changes in November become effective February 1st. So because you're becoming Medicare eligible in December, that itself is a qualifying event. So you'd be able to go ahead and move over to the Kaiser Senior Advantage plan, and your dependent would be eligible to move over to Kaiser HMO with you, okay? Now, if your dependent chooses not to go over to the Kaiser plan because they don't want to go over to the Kaiser plan, then so basically they're losing coverage because they cannot remain on the United Healthcare plan if you're moving over to the Kaiser plan. So what would happen then is they would need to enroll into our Cobra plan, which is only going to cover them for 36 months on that United Healthcare HMO plan. So it would be best if they both you both move over to the Kaiser plan. If that's what you're going to do, they should move over with you. Okay.
All right. And then there's another question. The question is, I plan to retire on November 1st, 2021. My last day of work will be on October 30th, 2021. It is Saturday. I'm 66 and will be 67 next month. I have Part A already. When I contact Social Security, the Social Security office to enroll. Let me see. Hang on one second. I have Part A already. So when I contact the Social Security office to enroll in Medicare Part B and inform a Sarah, I guess the question is, when do I contact Social Security to enroll in Medicare Part B and inform a Sarah?
Okay. So you're already eligible for Medicare. You got the Part A. You waived the B because you're still on the employer plan. So your last day is October 30th. So it really depends upon who your employer is, because some employers they cut off the medical plans right when you leave. So like they would drop you with, for November 1st. But if you're actually with one of the county employers, then the county your paychecks that in October is paying for November coverage. So then you would have coverage all the way through end of November. So we would pick you up on a Sarah's plan over on December 1st. So what I would do is I would just check in with your payroll person, and just to inquire as far as, based on your leaving at the end of October, when will your medical coverage end with the county? You can probably either check with your payroll person or check with Employee Benefit Center, and they can help you identify that when they're would cut off the medical for you. But during that time, before that time, you're going to be having your counseling session here with our representatives here at Acera. And so our counselors will talk to you about all that, and we'll make sure that you have the information to make sure you get your Medicare Part B, because you're already eligible. You already got the A. Now Social Security is just waiting to know, when do you want your B? So you would just need to contact them and say, okay, hey, I'm going to stop working. I'm going to lose my employer group plan. So now I'm going to need my Medicare Part B. And then they're going to want to know, okay, when do you need to have it started for you? Okay. So our counselor will be able to give you some direction on that the closer you get to that time.
Great. And then another question just popped up. The question is, I turned 65 in early December of 2021. already on Social Security in Acera and have Kaiser. It says I'm already on Social Security ND. I'm not sure if that was a mistype. And I'm in Acera and have Kaiser. Am I correct in thinking Acera will take... care of...
Mike, they're asking, can you hear me, Mike?
Yeah.
They're asking if they are already in Kaiser, will the enrollment into Senior Advantage be automatic? And the answer is no. Okay. So they have to enroll in Medicare Parts A and B, and then they have to complete a Senior Advantage election form and submit that to Kaiser to enroll in Senior Advantage. They also need to provide Acera with a copy of that Senior Advantage enrollment form and complete, if they're entitled to the Medicare Part B reimbursements, they need to complete that paperwork as well.
That is correct.
Great. Thanks, Yolanda.
Thank you, Yolanda.
Mm-hmm. And another question just popped up. How will this affect my 21-year-old daughter's health care?
Well, the way that would work is if you're on our Kaiser right now and you have your dependent daughter on the plan, so right now you're both on the HMO. So you would complete the Kaiser Senior Advantage election form, and we would transition you onto the Kaiser Senior Advantage once Medicare approves that, okay? And so what happens is basically it just lowers the cost, your out-of-pocket that you're paying for your own coverage. So right now, like maybe if you remember the example I provided, the HMO for you is $810. It's $810 for each of you, right? So you're right now you're paying, depending upon your years of service, you're paying an out-of-pocket portion for yourself, and then you're paying the entire premium of the $810 for your dependent. Okay, so what happens is you'll still pay the entire $810 premium for your dependent, but now your costs, you're not paying $810. Your costs will drop down to that $382 for the Senior Advantage, and then we would subsidize according to what we would pay of that. So your out-of-pocket costs would actually go down, quite a bit, depending upon what years of service level you're at. Okay. Now, your dependence coverage wouldn't be impacted.
Now, Ish, that was actually a new person, separate from the person that we were talking about previously. So what if they weren't going to go into Kaiser, but they were going to take a Medicare plan through via benefits?
Okay, so if you're already in the Kaiser plan and you become eligible and you decide not to stay on Kaiser and go on to Senior Advantage and you go outside, okay, then you as a retiree member is the primary anchor. Okay, so if you leave our plan, your dependent cannot remain on that plan. You can still go to via benefits or wherever you're going to go and get your Medicare plan. Then your dependent will be losing coverage. However, we would turn around and offer your dependent COBRA. Okay, so if they want to stay on the Kaiser plan, if that's where they are right now, they can stay on there, but it'll be through our COBRA plan. Okay, and so they would need to pay that premium to us, every month to make sure that we can keep them on that coverage, and that's only good for 36 months. Okay, yeah. Or you can carry them with you if you were to go to via benefits to get a Medicare plan, you can carry them with you over there and see what medical plan you can get them enrolled into.
Okay, so they can get enrolled in a plan through via benefits for their 21-year-old daughter.
Yes.
Yeah, great. Okay, and another person just wrote in. There's a new question that just popped up. I will turn 65 at the end of November 2021. And open enrollment is November. I have United Healthcare. Do I continue the same insurance plan if I plan to retire in March of 2022?
Well, so if you plan to retire, okay, so you're not currently retired. Okay, that's fine. No, you can continue your same health plan as is, and then when you retire, that is a qualifying event. So when you retire and come over to Acera, then we can go ahead and get you transitioned over to a medical plan that you of your liking that you have as an option. Okay.
Great, thanks.
Enrolling in Medicare Parts A and B. Okay. Again, if you're already receiving Social Security, it's pretty much automatic that they're going to enroll you. They're going to send you your card. They've been pretty good. Medicare's been good. They've been sending cards out to members well in advance. We have had some members who it's really close, or it is the month of their 65th, and they hadn't received their card just yet. So you can always just give them a call. I always recommend give them a call and just to check in with them to make sure that they have all your current information, to make sure that they got you all squared away. They'll let you know, oh yes, we're already processing your thing. It should be on its way. Okay. So so you can call them. Okay. You can go online to Social Security, or you can also visit the Social Security office. I believe they're starting to open some of their offices up. Okay. You want to make sure you stay safe. You know, I know we're still in this pandemic thing. So if you do decide to go to an office, you may want to give them a call and see if you can make an appointment to meet with someone one-on-one. Otherwise, if you did go into the office, even before the pandemic stuff started, you know, it was like going to DMV. Not that DMV is bad, but you know, you better make sure you pack a lunch and bring a good book, because you may sit there for a while. Again, you want to fill out the application for enrollment in the Medicare Part B. And just go ahead and just get your Medicare started with them. So you want to submit it in person. You can also submit it in person to any office. I believe they do have a drop box if they don't have, if they're not actually open for visitors. Okay. So, and then completing an application form for Medicare does not mean you're automatically enrolled. Okay, so you want to make sure that you Social Security has to take a review of your records, see where you are, how many quarters did you pay in, did you not pay in, and they'll make the determination about your eligibility to get you enrolled. Okay. Again, here's that window that I had talked about. It's a 7-month window. Okay, so it's 3 months before your 65th birthday, effective the first day of the birth month of 65. So the month you turn 65, it's effective that month on the first. It's always the first of the month. Now, birth month effective first day, 2 to 3 months after your 65th birthday. So basically, your birth month, 3 months before, 3 months after. Unless you're born on the first of the month, then everything moves up ahead 1 month. Okay. All righty. So again, Social Security enrollment period. If you missed your initial period, January through March each year, they do have another enrollment period, but then your Medicare would not be granted to you until July 1st of that year. Okay. And there's also a lifetime 10% penalty for each 12-month period that you did not enroll in Part B when you should have. Okay. The exception, working aged may delay enrollment in Part B until retirement. There was a member that had asked a question. As long as you're working, if you're still working and on your employer's plan, then you can go and get the A and just waive the B until you come off your employer's plan, until you decide to retire. Okay, that way you're not paying for a Medicare Part B premium, and they're not going to pay anything. Okay, because if you're on the employer plan, okay, it's a very rich plan that the county has, then that's going to be cover 100%. All right, Medicare is just going to say, well, we're not going to pay this bill. We're not primary. Your employer's plan is primary, but thank you for paying us a monthly premium. All right. So why you want to give them free money? So wait until you stop working and come off your employer plan to then go ahead and get your B. All right. Next slide. Again, employer plans. So if you're actively working, you want to delay your Part B and just use the employer plan. Okay. Yes, you can enroll in Parts A and B, both Medicare and your employer plan. There's likely no benefit from that, like I mentioned, because Medicare is going to say, okay, well, who else? They're always looking, who else can be responsible to pay for this bill? Okay, well, we see you got an employer plan. You're going to have to give them this bill because we're not going to pay it. So why pay the premium, right? Or, and of course, this is not a good option, is reject your employer plan and enroll in Medicare and then supplement in other ways. So you wouldn't want to do that, right? So that's, yeah, that's a no. That's a low priority one there. Okay, next slide.
There's a question.
Oh, okay.
The question is, I turned my Kaiser Senior Advantage forms by email to Sarah, per what Yolanda said. Is that okay?
That is fine. Yes. Okay. The team, once it's received, it'll be assigned to a team member. A team member will take a look. As long as they can open up the document and view it clearly, then they'll go ahead and move it over to the assignment queue and get everything processed and get it over to Kaiser's team that handles our enrollment members, okay? Because we have a designated team at Acera that handles and works with Acera for our members. If you send things in directly to Kaiser, it goes over down to San Diego into their main center hub, where everybody else who's trying to enroll in Kaiser is also sending stuff. But if you send it to Acera, we can make sure that everything's filled out completely and correctly, and that we securely transmit that over to our Kaiser team that handles our members, and they can go ahead and process that with Medicare to get you approved and so forth. Okay, so yes, that's fine. If you submitted it to us, that's fine. Make sure that you also completed the MBRP reimbursement plan, which is coming up. We're going to talk about that in just a moment.
Okay, thanks, Ish. There's a new question.
Mhm.
My spouse is on my United Healthcare insurance plan. If I retire in March 2022, is he paid through United Healthcare through April 2022? He has Medicare Part A, not used since he is on my plan. How much in advance do I have to notify Medicare to have him begin the process of Medicare?
Okay, so he already has Part A. You're on the employee. He's on your employer plan as a dependent. Okay, so again, so your retirement date is it going to be March 23rd? That's
March of 2022.
okay.
So March of next year.
Okay. Well, it all depends on what day you're looking at. Again, you can always, when you meet with your counselor here at Acera, okay, they'll be able to take a look at your scenario and look at the dates as far as what you're actually applying for retirement, and they can take a look to see what paydays the county is going to be paying you, and try to figure out exactly when the county's coverage will end. Okay, because you want your spouse to request for his Medicare Part B right when the employer plan ends. So for example, if your employer plan is going to end March 31st, then your spouse is going to want April 1st Medicare Part B. Okay, that way we can go ahead and transition you both over into the proper plan, and he'll have his Medicare and he can get into the Medicare plan accordingly. So when you meet with your counselor here at Acera, you know, they can take a look at the calendar and the paydays and so forth, and help you make that determination as far as when your coverage most likely is going to end with the county to help you transition over. Okay.
Great.
Okay, so here's the chart that I was mentioning. Okay, this is for 2021. Okay, so remember, they do a 2-year look back. So that means 2021, they're looking at your 2019 tax return. Okay, so as you can see in the first column, if you file individual, if you are claiming on your taxes 88,000 or less, if you follow that to the right, you see your monthly premium for the Part B is $148.50. Okay, if you're above that, if you're 88,000 to up to 111,000, then it jumps up to 207.90. Okay, if you're filing joint, okay, and you're claiming 176,000 or less, then it's 148.50. If you're claiming from above 176 up to 222,000 in the year for the both of you, okay, then your premium is going to be 207.90. Okay, so you can see how it jumps up a little bit there. Okay, now Acera is only going to reimburse the base amount, which is $148.50. Okay, so in your monthly retirement check as a retiree, you'll see a new line appear, because typically you see base amount, then you see your cost of living that Acera grants you, and you'll see this new line called MBRP reimbursement, and you'll see $148.50. Okay. And so we're giving you $148.50 in your pocket over here, but Social Security, they're taking whatever premium it is that they're going to charge you at, wherever you fall in that bracket, they're going to be taking you out of your pocket over there. Okay. So again, if you're not collecting Social Security, you're paying that three times. So you're paying it 3 months, because they're charging you quarterly. So 3 months, they're going to charge you, for 3 months in one hit. But every month we're already giving you the $148.50. Okay, and even if they're going to charge you the $207.90, right? If you're up there, that's not too much more above the 148.50. Okay, so that's still a pretty small portion, just under $60 or so, right? So, but you got to keep in mind, if that person, for example, even if you got 20 years of service, you're still paying like $232 your monthly out of pocket just for you to have your Kaiser HMO right now. So you're not going to have that $200 out of pocket cost anymore, but you will still have this cost over here from Medicare, depending upon where you fall in the bracket. Okay, but just keep in mind, we're going to be reimbursing you the 148.50 as long as you qualify. To qualify, I'm going to talk about that in the next coming slides. Basically, you just need to have at least 10 years of service in or a service-connected disability. Okay, and then you qualify for the 148.50 reimbursement. Okay, next slide, Mike. And here we go. So the Medicare Part B reimbursement plan, known as MBRP, okay, for the current year, we are reimbursing 148.50 into a member's retirement check. Again, this is a non-vested benefit and is not available for dependents, nor will it reimburse dependent costs. Okay, it's only for the retiree member. Okay, so to qualify for this, you have to have at least 10 years of a service credit, okay, or a service-connected disability, and you have to provide proof of enrollment in Medicare Part B and remain enrolled. Okay, if for whatever reason, and this has happened in the past, for whatever reason you decide to disenroll from Medicare, then we will stop this deduction. Not this deduction, but this credit. Okay, because you're no longer enrolled in Medicare. Okay, so enrollment in MBRP commences once we receive the form and the copy of the card to show that you have the Medicare Part B, from that effective date going forward. Okay, so if your Medicare is effective, let's say February 1st, and you send this to us in March, okay, well, we're not going to go back to February 1st and grant you the February 1st month of the 148.50. This is not a retroactive benefit. Okay, if you submit this stuff to us in December and it's supposed to be for February, we're not going to start granting you this in December and January because your Medicare is effective February 1st, so it would be showing up on your February retirement benefit. Okay. Again, we have to receive all the documentation. It's only 2 documents. Okay. It's the MBRP form and a copy of your Medicare card. It's that simple. And I know that, some people say, well, I don't have the card just yet. That's fine. You can still go ahead and submit in the copy of the reimbursement form to us, right? It's just a quick application. Basically, it's asking your name, an address, just mark that you've applied or you have a copy of the card, sign the form, send it into Acera. Okay, just keep in mind, when you do get a copy of that card, you want to go ahead and send us a copy of the card so we can add it into your digital record here at Acera and activate this reimbursement. Okay. All right. And again, this has nothing to do with the medical plans itself. This is a years of service benefit. So even if you are not enrolling into an Acera plan that we have, okay, whether it's our Kaiser Senior Advantage or it's through via benefits, okay, it doesn't matter. We have plenty of members who have retired with other agencies and they retire and get into their medical plan, or they waive our plan because they're on their dependents or their spouse's plan with their employer, and that's fine. As long as you have Medicare, you can still get this reimbursement, okay? Because this is a years of service benefit. It's not tied to the medical plan, okay? All right.
Okay, there's a question, and I think it might be about the previous slide.
Okay.
So let me go back to that one. Okay, so the question is, so regarding the $88,000 or less of income, what line is this on the tax return? That is it adjusted gross income or taxable income or something else?
Income of your monthly adjustment of money. That's a good question. I believe it's the
Adjusted gross income.
yes. Thank you, Yolanda. It is the adjusted gross income. I'm going to have to add that into the slide. That way we can make sure we have that clear.
Okay, great.
All right. Thank you, Yolanda. Okay.
Oh,
Nope, no, that's good.
was that it?
Yeah, it was because from there we went to Medicare.
Did we skip one? Oh, okay, I see what
Medicare.
happened. This kind of showed up twice.
Oh no, this is for the Part D.
Okay.
Yeah, this is Part D. Okay, so for the Part D, which is the prescription portion of Medicare, okay, there is, as long as you're, again, if you're looking at this bracket, 88,000 or less, you know, you're not paying a premium for the Part D. Okay, if you enroll into our Kaiser Senior Advantage plan, it has a prescription plan. The Part D is already built into it. Okay, so you don't have to worry about trying to enroll into a Medicare Part D plan for your prescriptions. Okay, so you don't have to worry about having to pay another premium for that. Now, if you go over to via benefits, they're going to enroll you into a medical plan because you have your Medicare, but then they also will enroll you into a Medicare Part D plan so that you can have prescription coverage. Okay, so again, if you're going to a Medigap plan or a supplement plan in Medicare via benefits, they're going to also need to enroll you into a Part D plan so that you can have prescription coverage. Okay. Now, if you're going into a Medicare Advantage plan, most Advantage plans do have a prescription portion to it. Okay, so most likely it'll have the Part D built into it as well. Okay, now, in addition to that, if you have income above a certain level, if you look at the second line there, above 88,000 up to 111,000, okay, then what Medicare does is they charge you this 1230, additional. This is called the income related monthly adjustment amount. Okay, it's not a premium to have Part D. This is just an adjustment that they charge anyone who has income over a certain level. So, and this, you do need to pay this adjustment to them, because if you do not, then what they do is they turn around and they disenroll you from Medicare because you didn't pay everything that you're supposed to pay, which is not good, because then that causes your medical plan to be disengaged from Medicare, and you can get disenrolled and have no coverage. So you want to make sure that if you fall into a higher bracket there, as far as taxes, as far as what you're paying for your salary, you want to make sure that you pay this monthly income adjustment that Medicare will send you. Okay. 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 Types of Medicare plans. Okay. Again, there's two types. There's the Medicare Advantage plan, where you're telling Medicare, okay, hey, this is the plan I choose. My Medicare is going to be assigned to here, and this is where my primary doctor is. Okay, so you have a primary physician that you need to select. You have to go to that primary MD to get a referral to a specialist. Okay, and again, the Medicare Advantage plans, most of them do have a Part D prescription portion built into it. Okay, so you get your little ID card, and you just pay your copay whenever you go into the office or go to the pharmacy. Okay, again, you must reside in the service area of that plan. Okay, now, if you decide to go into a Medigap plan, okay, or supplement plan, then your Medicare is not assigned to that specific medical plan, okay, or medical group. You have no primary MD. Okay, you can go see any doctor that takes Medicare nationwide. Okay, there's no referral needed to go see a specialist, and you can see any specialist nationwide that accepts Medicare. Okay, Medicare is nationwide, and so because you're not assigning it to a specific plan, that leaves you free to go see any doctor, any specialist nationwide that accepts Medicare. So you're here in California, and the specialists in the top in the nation for the eyes or the knee or the heart, whatever, is in Miami, and you say, okay, they take Medicare. I want to fly out there and visit that doctor and have them, that specialist, and have them take care of me. You make that appointment, just confirm they take your Medicare, and boom, you can go ahead and get out there and get that specialist to take care of you. Okay, you don't need a referral. Okay, again, these are only medical only. Okay, it does not have a prescription component, which is why you also need to get into a Medicare Part D prescription drug plan. Okay, so again, typically these do have copays. Some do have deductibles. It may vary depending upon the plan you select, the plan level. And again, they're only good here in the United States. Okay, because Medicare is here in the United States. It's not something from a different country. So you can't just go over to the other country and expect Medicare to pay for something. Okay. Okay. The plans that Acera offers. Okay, we have Kaiser HMO, we have United Healthcare Signature Value HMO, and we have United Healthcare Signature Value Advantage, which is also the HMO. Okay. As far as Medicare in-house at Acera, we only have Kaiser Senior Advantage. Okay. If you don't want Kaiser Senior Advantage, then you need to reach out to Via Benefits, and they can assist you to enroll into a medical plan over there. Okay. We don't do any enrollments over there. That's all handled over there with Via Benefits. Those are all individual plans. They're not an Acera group employer plan. Okay, so we have no information, no details, nothing as far as premiums or what types of coverages and so forth. Everything is done over there with Via Benefits. Okay. Next slide. All right. So our Kaiser Senior Advantage plan. Okay, you have to have to enroll. You got to have parts A and B. Although we do have a Part B only plan for those who find that they're being charged for the Part A. Then you can waive the Part A, just get the B, and we can still get you onto the Senior Advantage plan. But you got to keep that in mind. If you ever decide to leave this plan and go elsewhere, okay, you may need to go ahead and contact Social Security and have them grant you your A, okay, because on individual plans, they require both A and B, okay. So again, our Kaiser Senior Advantage plan, it's California only. There are Kaisers in other states, okay, so if you happen to relocate to Hawaii or Georgia, Washington, Oregon, other states where Kaiser is located, as long as you're in the service area of that Kaiser for that state, you can contact that Kaiser there and enroll in their Kaiser there. But mind you, those are not our Kaiser, so we wouldn't be able to continue the deduction for that Kaiser, because those are individual plans, because we don't have a contract for these out-of-state Kaisers. Okay, so the premium for the Medicare Senior Advantage plan that we have, by yourself, it's $382.21. Yourself with a dependent, both of you with Medicare, basically it's $382.21 two times. Okay, for each of you, so it's $764.42. Okay. If only one of you have Senior Advantage, let's say you have Senior Advantage and your dependent doesn't, or your dependent has Medicare and you don't, okay, then it's the $1192.93. Okay, it's one with Medicare. So basically it's an HMO and then also the Senior Advantage. Okay, the benefit of going into the Senior Advantage, one of the benefits is $10 copays. Your copays drops down to $10 from the current $15. Okay. Also, for our Kaiser Senior Advantage, we also have a hearing aid benefit for our Northern California Kaiser Senior Advantage. It's $1,000 per unit. Okay, so for each hearing aid, you get $1,000 towards that unit. You just need to make an appointment at the Kaiser Hearing Center throughout here in the Bay Area, and then you can go in and get tested and fitted for hearing aids, and then you get $1,000 per unit applied to that. Okay, and that's only for our Northern California Senior Advantage, not our Southern. So if you relocated down to Southern California, the hearing aid benefit does not apply to the Southern California Senior Advantage plans. Okay. Via Benefits, Medicare plans. Okay, so through the Medicare Exchange, there are not Acera group plans, just to remind you. These are individual plans. It will not appear on your monthly retirement statement from Acera. Okay. Members and dependents are solely responsible to pay any premiums to those carriers to maintain that insurance coverage. So basically, you reach out to Via Benefits. They help you to roll into a Medicare plan. Okay, they're going to ask you a bunch of questions. A lot of the questions that's on a normal application when you're trying to enroll. Okay, because it's all done over the phone. They will ask you your name, your address, all that stuff like that, what medications you're on, who your doctor is, what facilities you go to, what type of plans are you actually looking for. Okay, they'll be able to provide you with a few options as far as what's available in your area, and then you can go ahead and make a selection. They will assist you to get enrolled with that plan, and then with the carrier, you would make sure you make the arrangements as far as how you're going to pay your monthly premium. Okay, what happens is you pay, let's say Plan X. You sign up for Plan X. You arrange for Plan X that you're going to pay your premium. Plan X receives your monthly premium. They report to Via Benefits, hey, this retiree member from Acera paid us their premium. This was the amount they paid. Via Benefits then is aware that you paid the premium and how much it was, and they're able to look at the health reimbursement account that Acera will create for you over there and activate, and they'll see, okay, this person has a balance in their health reimbursement account, so we can go ahead and reimburse them what they paid for that premium, and they'll send you a reimbursement check. You'll be able to set up either you'll get a hard check mailed to you, or you can get a direct deposit, so they can reimburse your what you paid out of pocket right back into your account. Okay. If you're going to Via Benefits, I highly recommend that you, when you're talking with them, that you set up auto reimbursement and recurring reimbursement, and you do it with direct deposit. Okay. That way they can automatically, your premium is going to be the same every month. Okay. So they can help you set up to where you're going to automatically get that reimbursement for that amount every month, direct deposit it back to you. Okay. Anything else that's out of pocket, for example, if you went to the doctor's office and you paid an out-of-pocket cost for an office visit, or you go to the pharmacy and you had to pick up some prescriptions, you want to make sure you hold on to your receipts, because those also can get reimbursed out of the health reimbursement account. Okay, so you want to submit your claim to Via Benefits with the copies that show that you paid, and then they can go ahead and reimburse you. So long as you still have a balance in your reimbursement account, they'll go ahead and reimburse that for you for those items. Okay. They also have a website. You can go ahead and create your login, and you can track your claims. You can check on your reimbursements. You can submit your reimbursements all online. Okay. And their agents are always there, ready to help you out, assist you with whatever you may need. Okay. Again, this is only for the retiree member. The reimbursement is only for the retiree member. If you have a dependent over there, you can't submit your dependents out-of-pocket costs to get reimbursed out of their health reimbursement account. It's only tied to the retiree member. Again, it's done through enrollment via phone interview. Okay, so if you're gonna go on to a phone interview on your mobile phone or a cordless phone, make sure it's fully charged. Okay, because sometimes they say it could take about an hour or so, because there's a lot of information, a lot of questions they have to ask you and go through and input for you on your behalf to try and get you all processed and updated. Okay, so carriers over there, they do require both A and B. Most Medicare Advantage plans have Part D built into it. Okay, Medigap plans are medical only, so they'll need to also enroll you in a Part D prescription drug plan. Okay, a licensed benefits advisor will go over the plans available in your area and assist you with that. Okay. These plans are nationwide. Okay, we have over 2,000 retirees enrolled in plans through Via Benefits nationwide, because we have people all over the United States. We even got some people overseas, but they're not enrolled in Via Benefits. They're enrolled in something else. But I'm just saying. Reimbursement available for retirees out-of-pocket medical expenses like medical and prescription, plan premiums, prescription copays, deductibles, and any medical necessary costs. Okay. Again, you can set up auto pay, and also direct deposit is available. Reimbursement for the current plan year must be claimed by March 31st of the following year. So for example, right now we're in 2021. Okay. So you're going to the doctor this year in 2021, you're having services, you're having out-of-pocket costs, you're submitting items in to Via Benefits to get reimbursed. Okay. Let's say we're now in January or February. Okay, and you realized, oh, I didn't submit this item in to get reimbursed. This is from 2021. Well, you have until March 31st of 2022 to send in any claim items that you have out of pocket for 2021. Okay. Once again, you got to March 31st of 2022 for any items that you still have outstanding that you didn't get reimbursed for, submit for 2021. Okay, your HRA amount, your balance that we put into your account for you to get reimbursed, is there all of 2021. Come January 1st, whatever balance you have gets wiped out to zero, because January 1st starts a brand new year, and we put new monies in for 2022 in your account for 2022. Via benefits, they already know what your balance was at that time, at the end of the year, as of December 31st. So if you still had a balance, they know what it was, okay? And you should still be able to submit anything towards that balance that you still need to get claimed, paid for through March 31st, okay? So you still have a chance, okay? Again, online health reimbursement account and tracking and so forth, you can go online. If you created your account, you can check your balance. They also send balance reminders. So if you still have a balance towards the end of the year, they'll send you a balance reminder. Hey, you still have this amount, just in case you have anything. Okay. This is a very good tool. Very, very good tool. Via Benefits Prescription Profiler. If you're going to go into Via Benefits, when you call, make sure you have all your prescriptions with you. Okay. Because you can go ahead and provide them with what your prescriptions you're on. They can enter it into this database, and it gives them the ability to do a quick comparison as far as what prescription plans are out there. Okay. Typically, this is the main thing that is done right around mid-October by our retirees who are enrolled in Via Benefits. Let's say they got you enrolled into a prescription drug plan. You're over there now. Okay. And your prescription drug plan is costing you, let's say it's costing you $32, okay? And your copays on your prescriptions, let's say they're anywhere from, I don't know, $5 to $25, depending upon what the prescription is, okay? You give them a call, you say, okay, these are my prescriptions. They'll be able to enter that and do a comparison to see, are there any other drug plans available that's going to cover your prescriptions at a lower cost for copay, or even the lower premium. They'll be able to do a quick comparison and say, okay, hey, this plan is going to cover your prescriptions at a lower cost and a lower copay. Okay, well, hey, sign me up, and they'll go ahead and get you all squared away and transitioned over to that new plan. Okay, so it's a very good tool to reach out. And I always tell members, even if you're happy with the plans you have for prescriptions, it's always good to give them a call and just have them run it through their system for the profiler, just to see, is there a better deal for you out there? If not, hey, it's okay. It's good to know, and I'll just stay on my plan that I have. No biggie. Okay, but it's always good to check to see if there's any way you can save some money. Okay. Next slide. Open enrollment. Okay, so as you all may know, except for any of the newbies, we may not be aware of it yet, but ACERA, our open enrollment is the entire month of November. Okay, so you have all of November to submit any changes and so forth, to ACERA. Okay, those plans become effective February 1st. That's our plan year. Okay, for ACERA plans. Now, if you're switching over to Via Benefits, remember, those are individual plans. So with those plans, the open enrollment begins October 15th and runs through December 7th. Okay, and the plans become effective January 1st. Okay, so this is why it's very important that if you are going to switch over to Via Benefits, you want to let ACERA know so that we can make sure we stop any deduction that's going on currently, so that we don't charge you any premiums and so forth, because now you're going over to the Via Benefit side and you're paying the premiums directly over there to that carrier. Okay, so one's monthly retirement allowance must be sufficient to cover the cost of the elected health plan that you select. Okay, so for example, United Healthcare, the HMO plan is like $1,050. Okay, well, if you're only getting $900 as a retirement benefit, then of course you can't enroll into that United Healthcare plan, because it's more than what you're getting. Okay, just an example like that. Okay. All right. Again, just a reminder: retirees with 10 or more years of service must remain enrolled in dental and vision plans, as the coverage is subsidized by ACERA. Sometimes we'll have members who will contact and say, hey, I'm also on my my spouse's dental plan, vision plan at her job. I don't need your Acera plan. Can you go ahead and stop it? Well, as a retiree with 10 or more years of service, no, we can't stop it. We pay for it anyway entirely. So you just don't, if you don't want to use that plan, our plan, fine, go ahead and use that other plan, but you're still going to be enrolled in our dental and vision plan, because part of our contract with Delta to provide us a low premium is that we would provide all of our retirees who have 10 or more years of service to be enrolled in the dental and vision plan, and we pay for it. Okay. The only time you ever have a cost for the dental and vision plan is if you have a dependent on the plan with you. Okay. All right. Next slide.
We have a question.
Okay.
Question is, when does Via Benefits list 2022 choices/prices? Do you have info on 2021 costs so I can get an idea of what it might cost next year?
Well, members, we have, like I said, we have over 2,000 members enrolled in plans over with Via Benefits. And they're enrolled in over 236 different plans. So I don't believe that they have actual costs right off the bat where you can call them and say, hey, well, how much is this? And they'll tell you. You would have to talk with them and figure out which plan you're looking at, and they can see if they can get that cost of what the premium would be for that particular plan. Like I said, there's so many plans out there. It's almost impossible to just have a running list of everything. So you would want to reach out to Via Benefits, and they can probably tell you about the 2021 plans. But as far as 2022, that usually does not get released by all the carriers until closer to October 15th. And the reason being is a lot of these carriers, they have to report plans and items to the government, and the government has to give approval. Like Medicare has to approve certain items, structures and things like that with plans, and so they typically won't release the information until close to, or if not on, October 15th for the new plan year, that is, okay, for 2022. So and it's also a thing about competition, so plan A, they're offering this plan, and plan E is offering, this company's others offering basically the same plan. Of course, they want to try to offer it at a lower price than you. So, there's that competition. So, everything's held on to till right about the close time, and then they're able to go ahead and release that information. So again, you'd have to check in with Via Benefits as far as what the prices are for certain plans once that open enrollment period opens. And you got plenty of time. You got October 15th all the way through December 7th. Okay.
Ish. Is it possible to go on Via Benefits website and search through plans and see what the costs are?
Well, yeah, there's certain if you just go onto their website, there's a way to click and do a comparison. So you can view certain plans that are there. You can click and do a compare this plan to this plan, and you can kind of see what a cost is and what that plan offers. Like some plans may have the same premium, but one may have a deductible that's higher than the other. So it's always good to do a comparison. You can do that on the website. I've done it myself. But you can always just give them a call if you like, and they can probably try to assist you to go through the website. But I've done it but you can just log into the website and just start doing a comparison.
Sounds good. Thanks.
Okay. All right. So again, just a quick overview. This is the monthly medical allowance that Acera provides to our members. Okay. So again, for our in-house plans, the non-Medicare, let's see, these if you have 20 years of service for 2021, it's up to $578.65. 15 to 19.9 years of service is $433.99. 10 to 14.9, $289. If you have under 10 years of service, we don't subsidize anything. Okay, so for the non-Medicare in the HRA, these are also the monthly amounts that we put into the health reimbursement account for those who do not have Medicare and are over with Via Benefits. Okay, now Once you get Medicare, okay, over at the medical exchange with via benefits, then of course the 20 years of service person or the service connected disability person for 2021, they're getting $443.28 a month. Okay, and then $332.46 and then $221.64. Now, some members will call in and they'll say, well, what happened? Why did my amount drop down from 578 down to 443 just because I got Medicare? Well, when you become Medicare eligible, the premiums drop down significantly. Okay, so we have, for example, I have some members that they always call and check in with me, that they always keep in touch, which is great. I got some members who are enrolled in Advantage plans in other states, okay, and their premium is like $38, $44, something like that for an Advantage plan. So, at that rate of a premium, they're not going to go through the entire amount that we put into the health reimbursement account. Okay. There are some members who some Medicare plans will cost anywhere, can range from, like I said, like $48. Some even have no premiums, believe it or not. And others can go on up to like, $349. Okay. It all depends on how elaborate and what level of benefits you're actually getting. So, but a vast majority of our members never go through the entire health reimbursement account balance that we put in there. Okay. Very few, I would say I can probably almost count them just over a handful. And the reason that they blow through the monies before the year is out is because they have a certain ailment, and specialized medications can be pretty costly. And so they'll use up the funds just before the end of the year. But otherwise, the vast majority of members never use up the entire funds that we put into the health reimbursement account. Okay, and we are putting forth for 2022 for these amounts to be increased. Okay, so we will be providing that information later on towards the end of this year once we finalize everything with the Board of Retirement with the SARA. So we will be increasing our HRA amounts and the monthly medical allowances that we pay towards a person's medical plans. So the amount will increase from these amounts here. Okay.
There's a question. Does the Senior Advantage plan help pay for any type of gym membership?
Well, Kaiser itself, it does have a wellness program. Okay, so as a Kaiser member, you are eligible for some discounts. You can, I understand that on the individual plans for Kaiser, on individual Senior Advantage, they have some kind of gym type benefit. For Sarah, our wellness plan with Kaiser does allow you to have a discount. Yolanda, you want to go ahead and elaborate a little bit on that?
Yeah, so currently at this time, there is no benefit for a gym membership on the Acera plan. But as Ish stated, we do offer through the Kaiser Permanente Health Education Department, you can get a discount on gym memberships where you can get up to 25% off, I believe, on a gym membership. But you would have to go through Kaiser directly for that option, and it's through our health education department. And we do offer some virtual options available as well, like ClassPass and et cetera, that are available to you. But at this time, there is no gym membership. We are looking at possibly adding something for your next renewal.
Thank you, Yolanda. And Kaiser has a lot of items that are online. They have classes that you can watch, videos you can watch. You can do things for like meditation, all kinds of yoga stuff, all kinds of stuff that you can do. You can sign up, just go on their website and click on the wellness program items and take a look. We also have a lot of stuff, their items and links on our website, on the Acera website. If you go into our wellness section of the Acera website, there are lots of links from all the different carriers, from Kaiser, United Healthcare, Delta, VSP, a lot of different items there so you can click on and view and kind of go through it. Okay. All right. Qualifying events. Okay, so there's a loss of coverage. If you happen to lose coverage, that's a qualifying event. We can go ahead and help you switch over. You can get enrolled in something else. Relocating out of the service area. Annual open enrollment. Becoming Medicare eligible. retiring after age 65, marriage, new domestic partner. These are all qualifying events. So if you experience any of these throughout the year, you know, you need to make a change, or you need to add a dependent or drop a dependent, whatever the case may be, you know, these are the qualifying events. So anything's occur with you, make sure you reach out to us, Sarah, and that way our customer service team can assist you to get you all squared away. Okay.
And we have a question. Is the
Yes.
Part B cost of $148 per month that a Sarah pays, does that come from the monthly medical allowance?
It does not come from the monthly medical allowance. It's a totally separate program. It's a years of service benefit that's totally paid separately. It does not come from your monthly medical allowance. Okay. And also, it is not. It's not going to show up on your 1099-R for taxes. Okay, because it's basically not taxable. You don't have to claim it.
And none of the healthcare benefit subsidies are taxable.
No. So you don't need to claim. The only thing on taxes that I believe you can actually still claim is any out-of-pocket on them. Your out-of-pocket costs. So if you're on our plan and you have a dependent or you have a family on our plan, okay, remember, we're only subsidizing towards your specific premium. So you still have an out-of-pocket cost for the rest of your dependent or the family that you have on there. So whatever that amount is every month for the entire year, that is something you'd want to check with your tax preparer to see, you know, can you go ahead and use that on your taxes. They pretty much eliminated so much stuff off claiming stuff on taxes. It's almost like, you know, you got to meet a certain dollar amount before you can even claim it. So, but anyway, that doesn't hurt to ask, right?
All right.
Okay. Again, moving out of the service area, this happens quite a bit. You know, once a person retires and we activate that direct deposit, they seem to like vanish. You know, they'll move and not tell us, hey, but you know, as long as the money's hitting the account, they're all happy. But again, there's a lot of things that can happen by moving out of service area. You're going to lose your medical coverage. Okay. What if our Delta Dental DPO is nationwide? Okay. But if you're on our Delta Care USA, that is only in parts of California. So if you relocated, you might be also out of a dental plan. So we need to know so that we can go ahead and get you squared over, transitioned, and all taken care of so that you may remain covered. Okay. So it is critical that you look into the coverage area of your current plan before you jump over to that other location that you're going to like to move to. You may reach out to a Sarah for assistance in this matter. Please complete the Sarah address change form and update your record. Only a signed form will be accepted. Okay. You can't call us up and say, hey, I've moved, or send us an email. Okay. Because remember, we need to make sure that it's actually you who's trying to make this change. We want to make sure that no one else is trying to modify your account, because your account is confidential and secure here at Sarah. Okay. So retirees who reside outside of California may not be required to pay California state taxes. So of course, if you're not in California, then you don't want to pay California state taxes. So you want to make sure you submit a California tax form to us. And we have it online on our website. That way you can stop the California state taxes. Okay. Remember to send a Sarah address change form, name and address request form, which can be also found on our website. And that's our website right there. sarah.org/forms, and has all of our forms there ready for you. Okay. Again, you may email questions to us at info@sarah.org. Your email will be received. It'll be assigned to somebody, and they'll respond to you and provide you whatever forms or information you may need. Okay. Again, Sarah's always ready to help you. Thank you for viewing and have a great day. And we are here for any questions.